Ever wondered why there's such a vast difference in people's behaviors? What makes someone's personality so impactful on their life? Have you ever noticed someone getting angry too quickly or not being able to interact properly with others? Or perhaps, do you think there are deeply rooted issues within someone's character? If yes, then you're in the right place. Today's topic is personality disorders, meaning illnesses related to personality. This is a problem that puts many people in distress. Let's delve deeply into it. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. First, let's understand what personality disorder is. Personality disorders, or illnesses related to personality, are conditions where an individual's way of thinking, feeling, and behavior with others causes problems in their daily life. Imagine feeling like people are not understanding you all the time, or you are always in confusion, but you can't figure out what the problem is. These issues are so deep that they make living a normal life difficult. I hope now you have a bit of an idea about personality disorder. Now let's move on to the next point, where we will learn about its types. There are several types of personality disorders, each with its own symptoms and identification methods. Some of the important ones are borderline personality disorder, where an individual faces instability in relationships and intense emotions. Next, narcissistic personality disorder, where an individual considers themselves better than others and lacks regard for others. Next, avoidant personality disorder, where an individual avoids social situations because they fear rejection. Friends, these were some common or important types. Now we move to the next point, where we will look at its symptoms. There are many symptoms of personality disorders, but we have covered some common symptoms in this video. Some common symptoms of personality disorders are difficulty in forming or maintaining relationships with others. Next, extreme mood swings or rapid changes in emotions. Next, holding misconceptions or misunderstandings about oneself or others. Next, trying to avoid social situations. So friends, these were some common symptoms of personality disorders. If you know any other symptoms, please write them in the comment box. Now, we will see what causes them. Just like there are many symptoms, there are also many causes, but we have covered some common causes in this video. There can be various reasons. Let's start with environment and social circumstances. Personality development is influenced by your upbringing and care quality. Risks for personality disorders include, first, chaotic family life with issues like parental alcoholism or mental health struggles. Second, lack of caregiver support, especially post-trauma. Next, early life experiences. Childhood experiences significantly influence personality and coping mechanisms, which may not always be beneficial in adulthood. Those diagnosed with personality disorders often have backgrounds marked by, first, neglect, second, bereavement, third, abuse, emotional, physical, sexual, fourth, traumatic incidents, fifth, frequent distress. Next, genetic factors. Personality is influenced by genetics and environment. It's uncertain how much our inherited traits affect personality disorders. More research is needed to explore these connections. These were some common causes. Now let's move to the next point, where we will see what can be done to prevent it. There are some simple steps that can be followed to prevent personality disorders. Let's see. Regular mental health checkups. Next, regular exercise or yoga to reduce stress. Next, taking care of a healthy diet and good sleep. Next, seeking psychological help when needed. These are some common steps by following which personality disorders can be prevented. Now, let's move to the next point, where we will learn how its diagnosis or testing is done. Let's learn how the diagnosis is conducted. For diagnosing personality disorders, mental health professionals engage in detailed discussions with you, understanding your history. Sometimes, some psychological tests may also be conducted. These are some steps through which the diagnosis is made. Now, let's move to an important point where we will learn how it can be treated. Treatment for personality disorders is possible. There are some specific remedies. Let's begin. Psychological counseling, such as therapy sessions. Next, in some cases, medications can also be helpful. Next, participating in self-help groups or support groups can also prove to be beneficial. So friends, this was today's discussion on personality disorder. If you feel there is something missing in any point, please let us know in the comment box and share your strategies. Lastly, let's look at its conclusion. So friends, that was our discussion today on personality disorders or illnesses related to personality. If you or someone you know or a family member shows such symptoms, please seek help. Remember, seeking help is not a weakness, but a step of courage. Friends, I hope you liked our video today and that it has taught you something new and important. If so, please like this video, share it, and if you haven't subscribed to our channel yet, do so now, so you don't miss out on upcoming videos on such important topics. Take care of yourself and stay happy. Thank you.